Southern Cross Health Trust has supported the Calder Centre at Auckland City Mission since 2018. We're a national brand and we wanted to extend our support to include Wellington and Christchurch City Missions this year. We employ over 2,000 nurses throughout our hospital and healthcare network. We know that nurses are the cornerstone of the healthcare system in New Zealand, and we want to make sure that everyone has access to the healthcare they deserve regardless of their circumstances.
The Calder Health Centre is a general practice located in home ground at Auckland City Mission. We are a very low cost access practice with an enrolled population of around 2,200. Most of the people that come and use our services are engaged with other parts of the service at the mission, and we see a lot of people presenting with very high needs. We see a lot of people here that because of the work that's done by our clinicians and by our front of house team, that we see people that are engaging in healthcare that would otherwise miss out. The Calder Centre is a nurse-led practice, so nurses are front and centre of everything we do. They are absolutely essential for us to be able to deliver the clinical care that we need to. The tricky part of being a nurse in the Calder Centre is that you not only have to be at the top of your game in terms of clinical practice, but there is all of the social deprivation aspects that will be presented with, including a lot of people that are presenting with a history of trauma. So the nurses that we have on staff are supporting people through some very, very complex issues that aren't just pertaining to the clinical. So Lizzie is our nurse practitioner here at the Calder Centre, and her being on staff for us just lifts our game to a significant level. She has a high level of clinical understanding and expertise, which enables us with our wider nursing team to be able to deliver a higher level of care. Her ability for us to be able to diagnose and prescribe really aids us to be able to see more people in unique ways at the Calder Centre. So as our nurse practitioner, Lizzie approaches the work that she does with a massive amount of heart. She is a fierce advocate for the people that she supports and she sees on a daily basis. We see her time and time again go into bat for them to try and resolve some pretty gnarly issues, both from the clinical aspect but also from the social side of things. I think that you would hear very clearly from the people that see her that they feel highly supported, that they feel seen by her, which is kind of uncommon for the people that we support and other spaces where they interact with the health sector. The support of the Southern Cross Health Trust is really important for us at the Calder Centre. We, like most general practices around the country, struggle in terms of the costs that are associated with delivering care. What sets us apart from other general practices around the country is that our model of care differs significantly. We see people for longer and we see people with many more complex issues, which makes our service even more financially unsustainable to deliver. That's what's required when you are supporting people with high levels of trauma and that have high levels of poverty. And so for us to be able to do that, we need additional funding. And so this is where Southern Cross comes in. For them to be paying for us to be able to deliver a nurse practitioner role means that we can better meet the needs of those that are most marginalised from care.
At Southern Cross Health Trust, we're really proud to partner with the missions to support nurses who are making a tangible difference to the lives of people every day.